I'm 69 years old, and I began my struggle with Lyme disease in the mid 90s. Um, so it was before anybody in this region was talking about Lyme disease. Over a period of 6 years, my health went to being excellent, a wonderful, I would have been, what, 40-ish at the time? Well, in my mid 40s at the time, went to be from excellent to I was a person I no longer knew. I had what they call insidious onset, meaning that I didn't have a time where I got really sick and was bedridden. I just developed symptoms slowly over time, and people say, do you remember a bite? No, I don't remember a bite, nor did I ever see a rash. Just over a period of 6 years, I went from being a full-time professor teaching at a university to being unable to drive, unable to manage a checkbook, unable to well, some days I literally truly didn't know what day it was. And I'm not talking about it's the pandemic and I don't know what day it is because nothing's happening. I mean, I didn't know what season it was without looking outside to see whether there was snow or grass. In that 6 year period, ended up being diagnosed with dementia. And I'll talk after a bit about what that period of time was like in terms of medical response. But it destroyed my life. Um, it destroyed my life. Now, I am one of the really lucky people because my body eventually was able to fight the spirochetes on its own. By the time I had been reduced to being unable to leave my home, because when you have dementia, you can't even go for a walk because people think you're wandering and don't know where you are. When you have neurological symptoms that make you slur your words and walk funny because you don't have good balance, you look drunk. And so you can't even go for a walk. So I was literally stuck at home. So what is there to do but sleep? So when people say, well, how did you beat this? I didn't, my body did. But that's a very important thing, that your body can heal itself. Now, am I telling you that you should just sit around and do nothing? No, I'm just saying that that's all I had at the time. So my body eventually was able to fight back what we now know was neurologic Lyme. And after 6 years of getting sicker and sicker and sicker and sicker, and 2 years of being at home, my body began to heal itself and I was able to go back to work. Now, did it heal itself completely? No. I've never regained everything I had, but I would say I was 85% better. So some of the things that I still struggle with, pain, uh, tiredness or exhaustion, brain function problems, but compared to when I couldn't do anything, I am so much better. So you might ask, how does this all relate to Dr. Sult then? Well, because I didn't regain that 15%, um, I had a friend who was very concerned because I continued to have these issues. And she said, you need to go see my doctor. And I had had it with physicians. I have to tell you this, for those of you out there who have been to many, many, many doctors, you know what it's like. It's all in your head. There's nothing wrong with you. You're doing this for attention. You're doing this for secondary gains. I had been told so many things because it's a disability that other people can't see. So people didn't understand the impact that it has to have a chronic illness that allows you to look absolutely normal, but not always be able to function in a normal way. And like many people with chronic illness, I have better days, I have worse days, I have better days, I have worse days. So this friend, luckily, literally dragged me to Dr. Sult. She tried to get me to go. I didn't. She literally took me in her car and went into the session with me because I had been trained by this time not to say too much to doctors, because if you tell them more than a couple of symptoms, you can just see them glaze over. So I went into the office and Dr. Salt sat for an hour and he just listened and asked questions. He asked questions from my childhood. Did I grow up on a farm? Was I exposed to chemicals? Did I walk barefoot, in cow pastures? I don't even remember what the kinds of questions were, but He listened and he asked me things no one had ever asked me. And an hour later, he said, "Do you want me to tell you what's wrong with you?" And I truly didn't believe that he could. I'd been to so many doctors. Remember, from the mid 90s until I went to Dr. Sult in 2012. He said, "You have Lyme disease." And of course, I gave the standard answer, "No, I don't. They've done Lyme testing." And he said, "You're about to enter the world of learning about Lyme." And he began to explain to me why the Lyme testing that's done is not very effective. Now, because I teach at a university, I've had a lot of courses in statistics. And he's right. The testing is not very effective that is done by mainstream medicine. So I began my journey learning about what a Lyme spirochete is, how it gets into your body, how it gets everywhere in your body. And I began treatment with Dr. Sult. At the time in 2012, I did test positive for Lyme in the kinds of tests that he does. I still had Lyme in my body. And so we did treatment. And while some people had an amazing experience to treatment, what I think happened with me, because my body had found a way to live with Lyme, what that treatment did for me is it allowed me to continue to work for many years. I think it helped to keep the Lyme beaten down to a place where I could continue to function. And I'm very grateful for that. But the thing for which I am the most grateful is not even what Dr. Salt did for my body. The thing for which I am most grateful is what Dr. Salt did for my soul, for my sense of self, and for my peace of mind. Because for all those years, I didn't have a word, I didn't have something to help me to understand why my life was so different. I just can't tell you how grateful I am to Dr. Salt for his skill in listening to patients, in being there, believing their story.